Okay. Okay.
And here is the question. Right, so if you have read and understood, kindly begin your examination.
Okay. Wash my hand.
Yes.
Hello, I am Mohammed Al Ayan, one of the exam candidate. May I confirm your name and age, please?
Yes, there'll be no patient, okay? So just explain, you'll ask, you'll confirm, and then you'll begin your examination.
Yeah. Okay. Uh, Today I have been asked to examine the gland present in your face that would include look and feel and of the auscultate the gland. Are you okay? Would you please the lower down the color of your gown? Now I will start by talk close look to your face. Uh, Please, could you please clench your teeth for me? Now, inspect the swelling from the both side and from the front. Inspect the side and then the size and shape and the scar and the surface and overlining the skin. And now, would you please raise your eye, bro, and then would you please close your eye and do not let me open them. And then would you please blow your cheek and then would you please show me
Can you
your
say,
teeth?
I will ask the patient to blow your cheek, blow his or her cheek? Refrain your sentences a little bit. Like say, I will ask patient to blow his or her cheek, raise eyebrow, or yes. Give like say it like in giving instruction way, as if you're giving instruction. Yes, continue,
Yeah,
please.
yeah. Would you please the show me your teeth and then would you please tense your neck the muscle? Would you please and then would you please please open your mouth for me? And then inspect the tension duct by use tongue depressor to visualize tension duct to inspect for any inflammation or pus discharge. And now I will feel the gland. I am asked the patient, do you have any pain? And then start examine the gland from the behind it, palpate for the temperature and the tenderness and the edge and the consistency and surface and the pulsatile and the compressibility and the reducibility and the mobility and examine the lymph node. Start with the cervical and the pre-auricular, post-auricular, and the anterior cervical and the occipital and the supraclavicular lymph node, and the done skin pinch test. Hold the skin between your thumb and the index to examine the mass adherent to the skin. And now ask the examiner to dim the light of room and put light source into the mass. Look through the cone. And now I will listen to your lump for any brewery by auscultation by stethoscope. And now would you please open your mouth for me? I will feel inside by manual examination of the deep gland of the and the Stenson duct by wear glove and put your index and middle finger in the vestibule of cheek, and the other hand outside the gland and palpate a deep loop of the gland, and then wash my hand and thank you the patient.
Okay. So what was, can you present your case now? You still have 1 minute, but still okay, we can discuss.
Yeah, presenting the case, 56 years old male heavy smoker, complain of the swelling in the front and below the right ear since 1 month. On the examination, the swelling is comment on the inspection, the size, the shape, the surface, and overlining skin, and the comment on the palpation, temperature, tenderness, pulse style, compressible, and mobility, and palpate the lymph node, anterior cervical, preauricular, and postauricular, and occipital, and the supraclavicular lymph node, and the comment on the listen by auscultation, and after comment on the facial nerve examination if involved or no.
Okay, so what are your differential diagnosis of the lump?
Differential diagnosis, my professional diagnosis could be benign neoplasm and like polymorphic adenoma and Wharton tumor, and then another differential diagnosis, malignant neoplasm as mucoepidermoid carcinoma, adenocystic carcinoma, adenocarcinoma, and lymphoma, and could be inflammatory as Sjogren syndrome and the Mikulicki syndrome, and the infective as parotitis.
Good. So how would you manage this patient?
They'll manage the patient.
Yes.
They'll manage the patient after history and examination and investigation, like ultrasound and fine needle aspiration cytology and CT scan and MRI to assess the extension of local and bone and the perineural invasion.
Okay, and what should be the treatment of the patient?
The treatment after history and examination and investigation and after MDT meeting, they'll manage it could be surgery as superficial parotidectomy.
Good. Okay. Yes. So how would have you known if there was facial nerve involvement?
If the facial involvement could be mucoepidermoid carcinoma, like malignant neoplasm.
Yes. But how would have been the appearance on examination, just on inspection? You might have realized this in nerve involvement, and the lump may not have been painless, and it may not be like easily movable. See?
Yeah.
Now it was freely movable. It could have been fixed and could have been painful because of nerve involvement.
Yeah, and the mass fixed to the underlying structure, like masseter muscle.
Yes, good, very good. Yes.